Okay. So, we're going to start our meeting now for the Riverside Rest Home budget. And I'm going to ask, by the way, I don't know if all of you had the chance to look over the numbers or anything. I know it's been a busy couple of weeks in Concord. But the way we usually handle this, if you've had the chance, we go over our homework before coming. Ray usually gives an overview of what's going on. And we then quickly go through the budget in terms of the recommendations.
There's some.
And where we stand in terms of what's been spent and so on. And then, what we'll do is we'll take it, not vote on each section, but we'll take a final vote on the entirety of this. And we're open to questions along the way. So I've asked Ray if he would please do an overview of our budget for the Riverside Rest Home.
There are two things, you see the increase in operating expenses. What you don't see is that there was a $5 million increase in revenue. So the revenue increase far exceeds, and the revenue committee just approved the revenue. They were walking out as you were walking in. So, and that's, and you can see that it's in the book. So they've approved, like I said, they approved the revenue. And, so yes, it looks like a large increase in expenses, but it's more than $2 million offset by additional revenue. So I wanted to start with that. Second thing is, we are as close to fully staffed as we've ever been.
Yeah.
So, we're, in a much better position. And, we also have learned, that we are in the process of cutting our reliance on pool staff, and we never use traveling nurses, but we're we're cutting our reliance on pool nurses also, or pool nurses LNAs. And primary reason for that is, they're much more expensive than our own employees, for one thing. And second thing is, they don't really have a stake. I mean, I'm not making any personal insults there's wonderful pool nurses, wonderful pool staff, but they have no stake in the facility. It's not their home. And therefore they're there, and, but we might only see them once. So they don't really have any opportunity to know the residents, like your own staff would. Also, to give you an idea of the expenses, Rockingham County is the exact same size as we are in licensed beds. They spent $9.2 million in pool staff. Is what 75% of their staff are pool or traveling nurses. And it's 9.2. The least facility, I had to do the research for us. Maybe I could start for a second just by introducing who I have here. Dee Brown works with me. She was the administrator in Carroll County for 2.5 years. She's a licensed nursing home administrator. She replaced Brianna, who left. And I have Doug Kane, who's our director of maintenance, and I have respectfully called the Jens, the director of nurses and the assistant director of nurses, in case there's any medical questions that I might not be able to answer. I've asked them to sit in on the meeting. So, we're thrilled. Oh, thank you.
My apologies.
It's the gift. We're thrilled with the fact that, we're in a position of having our own staff. And not needing to utilize, I mean, we do have some money in the budget for pool staff as we finish orienting our new staff, but they're our staff from now on. And part of that is we did a multi-year, when ARPA money came to the county, the commissioners directed myself and Diane Legere, our finance director, to come up with a multi-year plan for the use of the ARPA funds and the expiration of the ARPA funds, which, as you know, expires December 31st of this year. And then, so whatever money we used for staff enhancement is now gone and funded in this year's budget. So they gave me 3 years, which is the time you have to spend your ARPA money to do that, and we managed to do that. The money we have left in ARPA now is to finish the roof unit, the air handling project that we've had going in this building. As you remember, this building was the last courthouse to reopen as a result of COVID because we barely made the minimum air exchange that's required by the state, you know, primarily because it's a 50-year-old building. But this will, God forbid we ever have any kind of widespread RSV or anything else, we'll be in much better shape once that project is completed. Unfortunately, we can only work on it on the weekends because our contractor can only work on it on the weekends because it's noisy and disturbs the court operation.
So you're pointing out, and you were talking about this building.
Yep.
In the last meeting, but now you're pointing up, are you talking about this building or are you talking about nursing home?
Nope, this building. But I just wanted to let you know about the ARPA money and where it went. So
Okay,
it's part of the conversation.
Thank you.
And I went over that kind of a lot in front of the revenue committee. There's a lot of questions and a lot of explanations with that. So in other words, we're done with the ARPA funds. Whatever staffing enhancements we gave through ARPA, as was, I had a plan that worked, as I was directed to do, the plan worked, and it's now funded in this budget. And we're done with ARPA. So, I guess those are the two. Oh, one last thing is an expansion of our behavior unit, in cooperation with the state. As you know, the state lost 2 lawsuits as a result of not promptly taking people in need at the state hospital. They lost the lawsuit in the New Hampshire Supreme Court because they didn't give the people proper hearings. And then they lost the financial lawsuit that the Hospital Association brought against the state because the hospitals had to keep people in the ERs because they couldn't put them in the state hospital and or Glencliff, which is a state operated facility for behavior issues. So we, I offered to expand our behavior unit. Part of the reason is it's a heck of a lot more money. They pay us almost 50% more than what we get for a regular Medicaid client. And we had the appropriate trained staff. And so far, we've completed our agreement with the state. Well, let's put it this way. We agreed to take 16 people by December 31st of this year, and we're at 13. And we'll have the last 3 in the next 2 weeks. So we're that doesn't mean we're gonna stop admitting there, but that means we've completed our agreement with the state. So that's worked out better. I think we'll all agree. It's worked out better than we planned for and better than we hoped. So we were real pleased about that. Those are the kind of overviews.
Do you want to mention anything about our relationship with hospice, with the Hyder House?
Well, Hyder House continues. You know, there's two forms of care provided at Hyder House. Actually, a few forms of care. General inpatient, which is people who probably only have a few days to live. It pays handsomely. However, we have to pay for the medication. So the net is probably is not great. Then there is respite, which earns us about $500 a day, and that's all hours. The medication for people there on respite is paid for by the respective hospice. And then there's people that a handful of people that are there. That just got the diagnosis of, a terminal illness, and families are trying to figure out what to do. So we might house somebody for a few days, a week, which is paid for by the hospice. And if it goes a little longer than the 5 days, the hospice gets compensated for. We have Friends of Hyder, which is a organization that is a nonprofit organization built around the support for Hyder, and they will agree to pay for a few days. So there's no uncompensated days at Hyder. It's paid for by one of those entities.
How many people at a time?
We have, today, we have 5,
How many can you take?
7 right now.
You can take 7, okay.
Yeah, and I budgeted for 6. So sometimes we'll have 7, sometimes we can squeeze an 8th in, kind of around the corner.
But your average 6, is that what you're thinking?
That's what we're thinking. That's what I'm thinking.
Yeah.
And we've had 7 and again, almost 8 at one time. We had somebody coming in but somebody passed. So, that's the unpredictable thing about Hyder is you don't know how quickly somebody might pass. So that's how I budgeted 3 general inpatient and 3 respite. Is what you see.
Okay.
In there. So that's obviously, Hyder is staffed differently, than nursing home. It's, and I don't mean this, I don't wanna get in trouble here.
You will.
It's a different skill set. Let's put it that way. It's a different skill set. And Jen used to be one of the directors at Hyder. So she can verify that it's a different skill set than what we employ at Riverside. So the nurses need to be trained differently, need to be certified differently and certainly the medications that are utilized and the way in which those medications are administered are substantially different than Riverside. So I guess that's the rundown about
Thank you very much for.
Hyder. And things that are a little different in this bill.
Thank you. And I want to thank all the staff members who are here. It's really appreciated that you've taken the time to come over here today. It really matters.
I actually have one thing, I'm sorry,
Yeah,
last thing. We just had our annual state survey
yeah.
They left on the 11th.
They left on the 11th of January. And we had a great state survey. We had one, what I would consider minor deficiency. We'd gotten a delivery of hand sanitizer. And you can only put 10 gallons of hand sanitizer in one room. And because we just got the delivery and hadn't had a chance to distribute it yet, we had 16 gallons in one room. So they cited us as a deficiency for it. And there was another deficiency that was added. We had a nurse that was pouring medication for all our rooms, as you know, are 2-person rooms. They had done the medication for the 2 residents in that room. There was an emergency that occurred with another resident. She took the medication, locked it in the med cart. So that part was right. But they didn't like the fact that she poured for 2 residents.
Yeah.
She only poured for 1 resident at a time, even though she knew it, but they added that to that one deficiency. So those 2 things made up the deficiency, but that's all, and we had some life safety things, but that's what you'd expect in a building that's that old. None of that impacts. So that should, once that's certified and all through the process, that's very likely to move us to a 5-star facility. Or 4 stars now.
Really?
So
Just because those 2 deficiencies?
that one deficiency would be enough to move us to 5 stars. Sure.
2 5-star?
To a 5-star. We were 5-star. We had a deficiency at Hyder a couple of years ago. With a med pump that wasn't operating correctly. And that brought us down to 4 stars. And now with this one minor deficiency, it should bring us back up to 5 stars. Because Hyder is considered part of Riverside, which is pretty unusual. We're the only nursing home that also has a hospice house in the state of New Hampshire. and they operate it together. So that we don't have to have a separate administrative staff. That my license, in other words, can cover Hyder too, with a waiver. So I have to submit a waiver saying that I'll cover both places. And so they let me do that. In fact, we just got the approval this week in the mail.
Are you all set?
That's all I have. I keep saying that and then something else comes up, but no, that's it. I'm done.
Okay, now, and over the years, Riverside has consistently had the highest ratings in the state. There are many times there have been no deficiencies whatsoever, and we're very, very lucky with that. I will say briefly, and I'll let most of you do the talking. I've dropped in from time to time unannounced to different departments now, and I've been hugely impressed. I know a lot about nursing homes and other nursing homes, and I must say, even though this is an old nursing home, the quality of care is superb. The relationship between the staff and the residents is beautiful. And you go in, for example, just to the recreation area, and it's one-on-one interactions that matter. You see people who are having real difficulties and someone's constantly stopping by. What can I do for you? What do you need? What do you want? It's remarkable. I also want to give great credit, staff credit. I have a constituent who lost her husband at Hyder, and she said that it is the most beautiful experience, if you can consider it that, for the passing of her husband. The kind of dental care, constant attention, every need met. We're just very, very lucky. Okay, getting down to brass tacks. Our fourth page is the administration. You'll notice that the administrator seems to get a high salary, but you gotta remember he holds two jobs. He's the administrator for the county as well as for the nursing home and Hyder. I have noticed consistently going down through that we have very little increases at all in salary.
Can I speak about that,
Yeah, you sure.
Madam Chair? You'll notice that when Brianna left, because it was a different classification, when D came on, she is the title says director, but that's D. And the situation is, Brianna was a nurse that took care of all of our COVID and a variety of other things and made a substantially higher salary. Now you'll see in line 003, which looks like a large increase. It's not a new position. It's a moved position. As much expenses, and Diane can verify this, as much expenses as we can move into administration, the better our reimbursement is. So because we're under reimbursed in administration, meaning, so when we submit our cost report, the cost report is in 4 different categories: administration, nursing, kind of the catch-all for maintenance, laundry, and variety of other things, and the last one's capital. The reason our reimbursement is a little less than some of the other county homes is we have no capital. Our building's long since depreciated. So we can't, we don't have as much depreciation as a lot of places do. But so I took a nurse. When we go out, before we admit somebody, we always go out to see them. I know this might surprise everybody, but hospitals fib sometimes about the status of a resident, to try and encourage us to take them when they're not ready to be discharged. So we always go to the hospitals or go to the home, somebody's home, and we were always sending a nurse. Instead, we put the nurse in the administration line, because that's considered an administrative task. And because we're under reimbursed through the ceiling in administration, it's better to put that person in there. Because it enhances our reimbursement. And Diane knows because she does our cost report that's submitted to Medicaid, Diane. So that's why that line item's gone up. It's not additional staff. It's a movement of staff from nursing into administration.
And that's a higher reimbursement?
Yeah, well, it's higher reimbursement because for each category of reimbursement that I mentioned, those 4 categories, there's caps. We're below the cap for administration, but we're not below the cap for direct caregivers. So as much as I can move out from direct caregiving into administration, it enhances our reimbursement. So we try and keep an eye on that, all the time, as much as we can possibly do. So, that's why you see the $45,000 increase. We didn't add anybody, we just moved a nurse from nursing to administration. And that nurse works to, go out and do the visits, the home visits, and instead of having 2 people, instead of having 3 people do the visits, we have the social worker from the unit and this nurse go out and do all the visits.
Ray, could you please address the audit, our audit for Riverside is 65% of the total county auditing that's done independently and professionally here, and we do, how's that reported out usually?
By number, well, as you can see from the award there, we've won the government, we've been awarded the government. You have to say the name, Diane, I always screw the name up.
Government Finance Officers Association.
Has awarded us for now 10 years in a row, 2022, the little sticker's not up there. And congratulations for our financial audit. So they take our audit that's done, the documents are prepared by Diane that goes to our independent auditor. When the audit's done, we submit the audit to this organization. They take about 6 months to review it. And then, we're one of the 8, as of last year, we're one of the 8 entities in New Hampshire that received the audit award. The state doesn't even receive the audit award. They did one year, a number of years back, but not anything since. So we're proud of our independent audit, which is very complicated because of the nursing home. How it's determined, how much of it is the nursing home, is simply the volume of checks. I was trying to figure out a way, because my salary's split that way. Not all my salary can be charged to the nursing home, because again, I do the rest of the county. So when the state asked how my salary is split, or how much of it is disallowed from the cost report that's submitted. So we just give them the number, we determine the number of checks that are cut and for payroll and payables. And that comes out to 65% is related to the nursing home. I'm not talking about dollars now, I'm talking about checks. And the state's accepted that as a reasonable distribution of salary, so.
Thank you very much.
Then I have to work a 50-hour week. Because if I work a 40-hour week, the nursing home license board requires that you have a 40-hour full-time administrator. So my pay is based on a 50-hour work week. 40 hours for the nursing home and 10 hours for the balance of the county. So.
You must have good health.
For a second.
I could help.
If there are none, let's move on.
I'm working off the, Jim, do you have a budget book?
Yeah, I didn't bring one.
Okay, I have one here.
Oh, I got one now too.
Yeah.
Oh.
You can have. Well, we were on page 23.
23.
David, so you know where we're going, we just need information systems, I see you're looking to bring up MAS systems.
So the biggest thing in MIS.
I can hear him, but I hardly can hear you, Janet.
You saw what?
Can't talk any
I
about
can't make out what you're saying.
It's the same. It's the same. I just
What's-
wanted to-
Oh, okay.
What's the same?
That's my,
These focus
that's my
page-
interpreter
the
up
focus
there.
Pages and this are pulled out from there.
Yeah, so the biggest challenge in the MIS department, and in order for us to have our insurance cover us for any type of interference with our computer system. We have to have certain firewalls and things in place. In fact, my MIS director just came back in the last couple of weeks. We have to go through a whole bunch of recommendations. We're no longer gonna be at co.stratford.nh.us. We are gonna be at .gov. Because they want to change the domain. We all have to change our passwords now to 11-letter passwords. Instead of, in the old days, you used to have a 4-letter password and you were all safe. Now we need an 11-letter password, so, and that's just a couple examples. But there's also things in here that we've had to do in order to comply with the requirements so that we can continue to have insurance in case of a breach. As you know, probably a few years ago, we had a breach through the sheriff's department. It did not involve the nursing home. And we were able to stop it, but our insurance paid for the extra cost. We didn't have anything stolen. We didn't pay any ransom. But we needed help to clean it up. And our insurance company paid for it. And starting from that point, they came out and interviewed me, because almost everybody in New Hampshire is insured through Primex, all the governmental entities. So Primex came out and interviewed me because we were one of the first ones to have a breach. And they then actually went out and hired a company to come out and audit all of their clients and make recommendations for enhanced firewall protection and those things. It's especially critical with us because we have everybody's medical information. You know, as you know, we're pretty much totally computerized. Short of a couple of things, we're totally computerized at Riverside.
One thing I've noticed really throughout the budget, how have you managed to keep insurance rates so low?
Well, you're gonna hear about it actually in a couple of minutes, but our insurance, our health insurance started at 18%. And we just kept battling and reduced it to 3.02% health for our health insurance. It was a constant negotiation, some amount of threatening to move to a different company, a variety of things, but we reduced it to 3.02%. The commissioners said 3%, and as close as I could bring it is 3.02. So I don't think it gets much closer, but it started at 18. We pointed out a mistake, it went down to 8. And then we negotiated to 5, and we said, no, we're not paying 5. We're gonna go self-insured. And I think that scared Anthem. And they said, okay, it's actually 3 point something with $150,000 kicker. Right? In other words, they gave us $150,000 off of our first bill. So it comes out to 3.02.
But that's just for this year, right?
Every year's a new,
Yeah,
every year's a new fight.
You get to do, so that's the guaranteed maximum price, was the 18%, was that the initial one?
That was correct, and we got it down to 3.02. Yeah, of course, I had a heart attack at 18. I don't mind telling you.
The school, Oyster River was 15.
So, yeah, we got it down to that. We fought pretty hard. Oh, and it took a while. I ended up having. What we learned is the entity that we use to help us with this. I asked them to do a back search for the last 5 years about Anthem's profit from insuring us. Cause you know, everybody thinks when you went through COVID that it
Couldn't get any worse.
but the truth of it is, the COVID years, because of a lot of elective surgeries and things weren't done,
Right.
they actually made a lot of money from this. So I brought up to the director of New Hampshire Anthem, look at how much money you made off of us in the last 5 years. I mean, come on. You know, this is a year where we need this to, you know, stay. And they came down to that 3.1 or 2, and then gave us the $150,000 rebate, which brought us to 3.02.
It's been a very small increase in this budget.
So,
Questions or concerns? Okay, moving on, to purchasing.
That went up $164. Purchasing, this is the purchasing for the entire county. So that we can, utilize the best pricing in group pricing. It's our longest serving county employee. Our purchasing director is our longest serving county employee. About 40,
Over
over 40 years. We had one employee that was longer, but unfortunately, she recently passed.
Well, it's a lot of loyalty, especially since you're gonna get an increase in pay.
Well, we'll talk about that when we come to it. Dietary is next. Primary reason it went up was cost of food. You know, we still, we prepare. I just had this figured out last night because I knew this was gonna come up. We prepare about 2,500 meals a day. Between the jail, the nursing home, and Hyder House. We prepare about 2,500 meals a day, so. And a number of them are specialty meals. You know, that you might imagine we would need at the nursing home. And it's not only specialty meals, but it's specialty textures. Thank you. Specialty textures so that our residents can swallow. Because they have difficulties swallowing. We also, when we get to occupational therapy, you'll see that we also can do swallowing tests in-house now. We don't have to send them to the hospital anymore. And you know, for some of our residents, they don't understand what the hospital's asking them to do for swallowing tests. But because we do it now in-house, it's a lot easier. You know, our residents trust our staff more, and there's a better way of communicating with them. So we do all our swallowing tests in-house now. We don't send out anymore. Which started last year. That was approved by this committee last year.
And I noticed in the backup information that this is a much easier test, if you can say that, for the residents as opposed to having to have the radiation and all that.
And for the system,
Yeah.
it's a lot cheaper, but I mean, it's not cheaper for us, but it's, you know, cheaper for the Medicare system, which would pay for the hospital visit. But it's really pretty cool. I never knew such thing existed till the occupational therapist educated me about it.
Thanks.
But
Any questions?
the primary increase in this is food.
Pardon?
I said the primary increase in dietary is food.
Yes, yeah. Next section, student.
Nursing.
Nursing.
Primary increase here in nursing is now budgeting for 120 more residents. Let's put it that way. So we have a financial, remember I told you we had a $5 million increase in revenue? Some of that requires us to have some additional nursing staff. So this is that's how this matches up.
Did you get away with giving only a $1 increase?
Well, you're gonna see that there is a line item for increases that's separate, that has to be approved. But we'll come to that. We were relying on ARPA funds for a period of time. However, remember the 3 years, no more ARPA, it's gone, and now we're funding it out of the budget.
On the nursing?
I-
Another document? Yes,
I do.
go ahead, Helen.
Since more than like half of all the labor costs, or actually more, are with RNs and LPNs and LNAs, why don't we have the nursing staff hours per year listed in the budget?
Oh, a good question, and I'll produce that for you, because I sent it to Mr. Lerman, because he asked me for it. So I have that calculated, and I will send that to you right after this meeting's over.
Yeah, so, but that, as well as then the whole assumed reimbursement rates, really needs to be in the budget as well, because then we don't have, especially when we have a new nursing home, we've got nothing to base it on.
That's
That's
back up in the revenues budget. It shows how many residents per day, how much per resident.
Not for each pair class, you don't have it by.
Yeah, it's in the, it's in the backup. Or it's not in that budget, it's in the backup for the, I sent it to Mr. Lerman, but it's also in the backup for, the revenues, revenues and capital expenditures committee.
Okay,
It shows, but I'll send that to you.
okay,
It has per resident, how much, remember, this is a 366 day year. Okay, it's not a 365 day year, and that one day makes a lot, big difference. So you'll see when you get the budget, when I send you that backup that I sent to Mike Lerman, that you'll see we budgeted 366 days of revenue. I didn't want you to think I was crazy. I just want you to remember that there's February 29th this year.
Coming up any minute.
So when, everything's times 366 days. So as an example, it'll show 360, it'll show how many days in the first half of the year, how many days in the second half of the year, what we expect our reimbursement to go to in the second half of the year, what it is in the first half of the year, what it is for Medicaid, what it is for Medicare, what it is for hospice house, what it is for our behavior unit. It lists all of those things. And I will make sure we send that to everybody, that whole thing that I sent to Mike Lerman. In fact, we'll send it at the second meeting's over. We'll send it to the whole delegation.
So the procedure then is the revenue goes to the revenue committee and we're basically looking at expenses.
That's
of this
correct.
committee.
That's the process.
Yeah.
Now, I'll change that process. I've probably changed the presentation that I've made to the delegation. Over my 36 years, I've probably changed it 15 times. Because different delegation members are interested in different presentations. I'm happy to change it to anything that the delegation wants. You know, so I'll make notes, like tonight when I go home, I've got 3 subcommittees today. So I'll make notes tonight from each, that Janet will help me because she's recording this stuff, and I'll watch this that comes on YouTube. And I'll pick up things that I can make for changes. Like there was a ton of changes in the way in which we presented revenues. That Representative Southworth wanted as being chairman of that committee. So we made a lot of changes in how that budget was presented. I can make those changes in this budget.
yeah, because if they're disjointed, I know what you're saying, another committee is, everything that's in here is based upon, you know, expenditures and revenues and all of that, and if we can't see all the parts, how they're working, then, you know, projections don't mean anything, that's why I'm saying.
I'm happy to send it to you.
Okay,
I've done it. It's completed. I sent it to Representative Lerman a week or so ago. Week or 2 ago. Yeah, well, the first one I answered, I'm gonna send you both of these. The first set of questions that I answered were questions that were asked by Mrs. Rice. She asked the questions first, so I answered her first. The next set of questions I answered were Mike Lerman. And then the third set of questions were questions that Representative Newton asked me on Tuesday. That we got to him yesterday. I'll send you all 3 sets of those. Because they might all come up at some point during the delegation meeting. So Janet will send that out when this meeting's completed. So you'll have all of those things.
Social behavior units, pretty significant.
Yeah, it's, again, that's what I started with, was the, our agreement with the state. So now our unit 1, is now, and I'm gonna change the names. I don't like behavior unit and dementia unit, so we're gonna run a contest amongst the employees to change the names. I just think it's wrong to designate somebody in that way, so we're gonna call it something different.
Especially because there's a stigma with the behavioral part.
Yeah, so this is the budget for the behavior unit. There was a little bit of addition here related to the fact that it's generating $1 million in extra revenue.
Can I ask about that? Cause when
Please.
you, okay, so just so I can understand the numbers, can you
Mhm.
explain again, like when it started, how many, you took in and how many now? And I just want to write those notes down.
Sure,
Okay.
of course. So the behavior unit started about 20 years ago. The director of Medicaid at the time called the counties together and asked if who would be interested in running a behavior unit. The way our building lays out, we were a logical candidate to run a behavior unit to help Carroll County, Rockingham County, and us. There's 3 behavior units across the state. Cheshire has one. Hillsborough has one. And we have one. So. It pays about, close to $100 more per day. Medicaid compensates us approximately $100 per day more, but you'll see that, Representative, when you get the sheet, because it shows the exact amount times the exact number of residents. So there's 42 beds on that unit.
Okay, that's what I was looking.
Yeah,
at.
there's 42 total beds now that we're utilizing on that unit.
42. Okay.
42. Of that 42, we budget for 36 for one primary reason. The primary reason is that there is some behavior people that are a potential threat to a roommate. And we have to take into account that we can't team up everybody that's on that unit. It's just
Yeah,
not
it's
safe.
not safe, yeah.
So, now if we can take 38 or 39, because we have the right mix of people, we're gonna do it. Because it's extra revenue for us. But I only budget for 36 because I don't wanna put pressure on nursing. And I don't wanna put pressure on our director of that unit, who's, a licensed, social worker, and LSW, so, she's licensed by the state, who manages that unit. I don't wanna put the pressure, and I don't want anybody to get hurt.
Yeah, of course.
So we budget 36 of potential 42. And you'll see that when that document comes to you. And they pay us about $300 a day as opposed to $212 a day, so it's some extra revenue for us. And it also bailed the state out of their 2 lawsuits. So it's always nice to be in good graces with the people that pay you.
Yeah, we want to thank you for that question, because I was gonna ask you to explain on.
Just as an off, I put a bill in that has to do with a mental health piece. Now, of course, she's not elderly, but, so she was basically being held at a jail up in Belknap County because there was no room. So are you utilizing the jail in any way for that? I mean, that would, in an elderly capacity at
Never.
all? Okay, good.
And not only that, we monitor we monitor 545 people in the community that would 3/4 of which would otherwise be incarcerated. Of that, 60 or so, between 60 and 70 people are monitored from a mental health aspect,
In the jail right now?
out of the jail.
Oh, out of the jail.
Out of the
Okay.
jail. So they'll come in.
Yeah.
The biggest sin to me is somebody who's been arrested for allegedly committing a crime, but really has only done it because they're mentally ill.
Mm.
So when our program at the jail, somebody goes over in the first thing in the morning before court and assesses that person. If they're, if they're suffering from a mental incapacity, we'll have them, then we'll go to court, we'll get an order from the judge that allows us to release them once they're established with, in our case, community partners, our local.
Yep,
And I will tell you completely, honestly, most of those people are established with community partners. They are known to them. But the problem is they might be off their meds.
Correct, yeah.
So what we can do is monitor them through our community corrections program to make sure they keep their mental health appointments.
Okay.
And to make sure they are taking their meds. And that keeps them out of the jail. Because again, the second biggest sin is putting somebody in there for not paying child support. That's a whole nother subject, and a whole nother program that we have. But this is you're 100% right.
Okay,
And if you need testimony on your bill, give us a call.
okay,
And I don't care how old or young that person is.
okay.
It doesn't matter. It's a sin to put somebody in jail who's mentally ill. There's plenty of community resources. Just to let you know.
Okay, cool. On that note, back to the chair.
What was that? Going on to, I can read.
So resident services,
Yes, please.
we are required by the federal government in order to run a nursing home, to do certain documents. The primary document is called an MDS, which is a minimum data set. What it is, if you printed it out, it's about a 34-page assessment that has to be done on a resident every 90 days. And then if there is a change in condition, a better or a worse condition, you have to do a mini MDS. I'm just looking for verification. You have to do a mini MDS on them. And that document is part of how our reimbursement rate is set. And as well as meeting federal requirements. So the director, I gave her an increase because when Brianna left, that director took on additional responsibilities. So I gave her and our infection person that $5,000 raise you see, and you'll see it on our infection person also. But remember, the line item that Brianna was making 180 something thousand, and poor D makes 111. So, I mean, not that that's poor, I'm just meant that there's a difference there. And so besides the 111, I gave two people $5,000 raises for their additional work that they needed to do because it's work that Brianna had done when she was here. So, part of her work. So that's where you see the change there. And actually, otherwise the budget would have gone down. So that's three people, that they go up. And also the way we've established in cooperation with our director of nurses is that they now do a lot of the assessments with input from the nursing department. So it allowed us to change the nurses on the units from doing that paperwork to do real nursing. And these people are more assigned to do the paperwork piece of it as opposed to the nursing piece of it. And otherwise, what we did at the beginning was we had to train each nurse on each unit on how to do this MDS paperwork. It's ridiculous because they spend half their time doing the paperwork and not doing nursing. So that's what we ended up doing.
This amount of paperwork, I know people who have left nursing because of that. They're in it because they want to serve. But they're sick of the paperwork, it's really sad. There's gonna be a way to improve that.
So the next is maintenance of,
Can I just?
oh, sure, please, anything.
MDS assistant, that's 3 positions?
No, that's two.
2,
So there's one at the top and then two beneath her,
okay.
A total of 3. but-
total of 3.
Yeah,
Okay,
that's
thank you.
3.
Yeah,
Yeah.
total of 3. The next one is maintenance. Doug's here. Doug is our, Jim Gagne, our, longtime maintenance director, who just retired. Doug's taken over the last year or so. You're on, Doug. Give him a little information.
But I'm not on that.
Oh,
Good
there it is.
afternoon, everybody. Thanks, Ray. My name is Doug Hayne, and I am the maintenance director for Stratford County. So I'm responsible for all of the facilities and all of the grounds on the county property. I've been at this job for a year, and this is my first budget that I've submitted. And I believe that with this budget, we'll be able to solve a lot of long-term issues with the facilities that we've had. It'll be some permanent fixes that will allow us some breathing room so you folks can make informed decisions going forward on the new home. I think it's very important to everybody. I would like to go down the line and start with the increases, if you don't mind, and with some explanations for those. A decrease is for maintenance crew. I eliminated a position that I did not think was necessary in order to give us some room to repair the building and to compensate some of the other staff that's there. I am asking for an increase in overtime. Overtime has become a necessity lately, with support of the county as a whole. These folks, my 13 maintenance guys are operated and paid for out of Riverside, but I have one over at the jail, and I have sometimes one over here, assisting the gentleman who's here, mainly for snow removal, mainly for issues that pop up with this facility. A requirement of mine, and what I fully understand, is that this facility is basically a rental unit for the state courts, and that is a revenue stream that needs to come in. So we need to be able to respond quickly and thoroughly to repair things here. At the jail, we have issues that could possibly cause a riot. We have issues that could cause us to lose ICE or DOJ contracts. If there is no air conditioning in the hot season, if there's not enough heat in the wintertime, any of these things could potentially be a problem for everybody. So it's important that I have the flexibility to pay the guys to come in at 3 o'clock in the morning if something breaks, and not have bigger problems. I believe it's a modest increase, and frankly, 1 3-day snowstorm could wipe right through that overtime budget, maintaining grounds and such. The next item I'm looking for an increase on is electricity. That is a best estimate that I have available at the time, using the figures that we have for usage, according to our LED upgrades. Going forward, when we replace lights, it gets an LED replacement. I think that's a smart option. And I think the secondary issue that we have is these are old buildings, and we are placing electrical demands on them with their existing infrastructure that is frankly, we're maxed out in a lot of panels.
The other piece is we just finished a 3-year bid on our electricity. You know how much electricity has gone up in the last 3 years.
Yeah.
So even though we bid it, we bid it out. This is the best bid we got times the amount of kilowatts that we use. The new pricing starts February 1st of this year. We were smart when we bid it, at least the last time we bid it for 3 years. So, we got a really low price for that 3-year period. Unfortunately, we're subject now, we pay quite a bit less than the market, because we're a large user. But we had to recognize that, with the bids we got, we took the lowest bid.
Question? So February 1st started not a 3-year, was it another 3-year
No, 18
lock-in?
months.
18
And I'll
months.
tell you why.
Can I ask about so coming off of a 3-year,
Mhm.
right? What was the increase from the 3-year to?
Almost 30%. And we went, but remember that the reason we went to 18 months is 2 reasons. One is a year was more expensive than 18 months.
Yeah.
And 2 years was more expensive than 18 months. And 3 years was even more expensive than 2 years. I think because the companies that we buy from don't feel they have a reliable market, that they can give us a prediction of, I think as far out as they can give us a safe prediction is 18 months. That's what we've been told by the consultant that we use to help us bid these things out. That's because I've never seen a bid that's been more expensive, per kilowatt in 2 years or 3 years than it is at 18 months. I've never seen that before. Usually it's less because, they're locked in and they don't have to redo paperwork and all those things. This is the first year I've ever seen that. That's more expensive. So we chose the 18 months because it was the cheapest per kilowatt. Frankly,
When's that expire?
18 months from February 1st.
Oh,
And to complement what Administrator Bauer says, I think we're seeing that a lot lately with commodities, fuels, gasolines, that sort of thing. The companies that buy and sell these things aren't willing to take gambles beyond 18 months because of such fluctuation. We've seen that in the past wars. If a war breaks out somewhere, guess what's gonna happen to gasoline? Yeah, we're not gonna be able to get anybody to hammer down a price on us and get that locked in rate for commodity stuff.
You
Yeah,
see,
so-
you see recycling too.
Sure, yeah.
Yeah,
Waste to fuel, there's a perfect example. My wind waste bill jumped considerably this year, so we had to reorganize, we're down to, one less dumpster right now. We're recycling more. One of the programs that we're doing is Berwick Scrap Metal brings over a metal dumpster. The kitchen now, instead of throwing the metal into there, they throw it into the metal bin instead of the recycle bin.
we pick up about a couple of $100 a month.
Sure.
But the biggest, that's just in revenue.
Yeah.
But the biggest thing is we don't have to pay to have it trucked out.
Yep.
'Cause you know,
Per
can't-
pound.
Yeah.
You
Per
know,
pound every time.
And also the frequency of emptying, because there's a fee in that too.
Mhm.
But if you think of a can that we buy, you know, like this big around, this tall, it's a lot of wasted space in the dumpster. You know, because
That's
it's, you know, it's not full. So if we can, not only do we wanna recycle, but they'll pay us for it. And what it might be considered to be an unsightly big dumpster is way out in the back where nobody sees anything anyway.
Sure.
And, they come and pick it up when it's full. So anytime we can fill it, and we're happy to take everybody's scrap metal because we get paid for it.
Sure.
So any of our tenants, if they wanna throw stuff in the scrap metal pile, our community work program will come and pick it up for them and throw it in there. And then when it's full, we call them and they come and pick it up, and it's from Farmington.
And
It is,
I'm
yeah.
billed weekly from the waste providers, the waste recycling place and the compactor company. And I keep a close eye on the pounds that we use every week.
Mhm.
And I see a direct correlation between, say we have a COVID outbreak at the home. Now the kitchen by Medicaid standards has to go to styrofoam serving.
Oh, my
And
God.
we're talking bags that you can, you know, Christmas bags of styrofoam. So now all of a sudden we are getting up against, all right, maybe we need an extra pickup, maybe we that. So it fluctuates. And thankfully, we've had low instances of COVID. this
I have
year.
no COVID. I have no COVID right now at the nursing home, and in fact, we just did we didn't, but Rockingham County just sent a poll out, and we have, I can only tell you county homes, I can tell you that there's another local home that I'm waiting 3 people to be admitted from that local home to Riverside, and they have a total RSV outbreak.
Mhm.
So I can't take anybody from there and worry about bringing an RSV outbreak to Riverside. So the admissions are on hold. I will tell you that we've had almost no COVID, and and one of the other counties has a big flu outbreak. I haven't had flu in 3 years. I mean, we're aggressive with flu shots, don't get me wrong. But we've been fortunate, knock on wood, so to speak. We've been very fortunate that we've had almost no COVID, and we have no COVID right now at all. We have 1 employee with COVID, but no residents. We thought we were gonna get killed at Christmas, you know, because a lot of our residents go home for Christmas. And we thought with the exposure to the community, because there's quite a bit of COVID, and we're still losing 1,000 people a day nationwide to COVID, if you believe the national statistics. Okay, I'll throw that out there. It's not my statistic. But I will tell you that there is, you know, we know it's in the community. And we also know based on state statistics that we're one of the highest areas for COVID. So we consider ourselves fortunate that we don't have any cases. And the other thing is, when we do have cases, they don't spread. You know, we might have had 2 or 3 cases at one time. And in the old days, when COVID first came out, 2 to 3 cases would be 20 cases. Because we didn't know what to do. Now with 2 or 3 cases, it stays. It stays confined, and I mean, we have to still gown up. We have to put eye protection on, we have to gown up, we have to mask up. That's federal regulation, we have no choice, even if we believe differently, doesn't matter. When we're inspected, that's the first thing they look for.
Peter's been very patient. What is your question, Peter?
Isn't it the case that several, probably about 10 years ago now, when this new commercial power distribution situation or system came into effect, that a lot of small marketers suddenly emerged and they got bombarded with offers to buy from somebody besides.
Yeah, different, you're talking about deregulation, yeah.
Yeah, deregulation.
Yeah, and that's
Yeah, a
helped
lot of
us,
those companies guessed wrong with their
and then they
predictions.
went bankrupt.
They all went bankrupt.
And I think that's what everybody's afraid of now. That's because they just don't have a good sense about the reliability of the pricing of power.
Right.
That's why that 18 months seems to be the sweet spot right now.
Yeah, that's what I was gonna ask. So it doesn't happen, it's only happened a couple times in like 10 years or whatever. If you're locked in and for some reason we're doing something statewide where they say we are supposed to be doing something to take these energy costs down, is there a way to,
We can get out.
you can?
Yeah,
Okay,
But I'm looking right now, I'm actually looking with the city of Dover.
yeah,
Dover's about to offer one of those power agreements. Representative Bixby, I
Yeah.
think, is on the
Yeah.
committee.
yes,
And he and I were talking about it today at our budget meeting.
yeah.
So yes,
He's
is
on
the
that.
answer. If we can get a better deal through them, that's part of the agreement.
All right. My last question was about food waste. Are we
Yes.
doing anything in that?
Composting, you mean?
Yes.
Something like that? That has been looked into, I believe. I believe that Medicaid has restrictions surrounding infection control.
But we still provide food waste to the pig farmers.
Yeah.
Oh, you do?
Yeah,
Yep. Anything that is,
Dougie LaChance.
I love
Okay,
Yeah.
yeah, I'm totally for the pig farmers.
Yeah, I didn't know
all
if you knew
about
Doug, I mean,
Yeah.
he's famous around Rochester, so. I had an understanding with him where he will we'll give him whatever food waste we have.
So you're saying if you're not even allowed to give it out, like if it was, because the county property is amazing,
Well,
right?
it's-
You
it's-
have an unbelievable opportunity to do composting.
Yeah.
I'm in environment and agriculture,
Mhm.
so is Peter Bixby, Representative Bixby, and so it's a huge thing. The amount of food waste in the state is redonkulous. So,
100% correct.
and there's so you're saying that you wouldn't be able to do that on county property?
The current layout of the building.
Yeah.
Is a restriction for us for placing any sort of device nearby the building where there would be rotting food, because it would attract pests, it would attract
Yeah.
eagles, it would attract. Lord knows what, really, rats and rats
Yeah.
at the river are a huge problem.
Yeah.
We actually had somebody donate a large amount of canned tomatoes recently, over the summer, and they.
Massive amount.
A massive amount, yeah, a logging trailer full, and they had no idea that it was expired, or maybe they did, but regardless, that went immediately to the pig farmers. So,
Oh,
yeah,
great,
yeah, we
okay.
do,
Yeah, cause they don't care, I mean,
No,
it
yeah.
doesn't matter if, we can't feed the residents with it, but, I mean, as long as the pig farmer recognizes that, it's expired and
Yeah.
we show them, says it right on the can.
Yeah, it's fine for the pigs
And
as
that's-
long as it's not
And I've put
moldy or
signs on
whatever.
our new compactor about what's acceptable in there and what isn't, and where the cardboard needs to go, and if there's
Okay.
any steel or wood, it needs to go back down to either be burned or be recycled.
Okay,
You also need a specialized facility for meat and dairy.
well, yeah,
Yeah.
those are, now I'm not talking about those pieces with compost, but yeah.
Yeah,
those
and
we
again,
can
every
compost
every
those, so-
can that we give to the pig farmer stays out of the compactor and stays off of our bill.
Okay, cool.
Oh, so you give them. He doesn't get food scraps, but just stuff that's in containers?
We try and give them whatever food scraps, they can take, but you need to appreciate with 2,500 meals a day. It's sometimes we have, relatively, we need. And this is one of my pet peeves with Medicaid, okay, we need to serve a resident a full tray. Even if we know that resident's not gonna eat a full tray.
Yeah.
Okay, we don't have a choice. Even though we assess and we assess and we assess and we know, we record, the nurses' aides record the amount of consumption that a resident has at every meal.
Yeah.
We record weights weekly. And to see if there needs to be a dietitian intervention to determine if there needs to be an altered diet calorie wise.
Yeah.
Even if though we have all that information, a resident needs to be served a full tray. So there is more waste than I would like to have. And I think that anyone would like to have. I mean,
Yeah.
when you're cooking it, or I'm cooking at home, I know how much my wife and I are gonna eat. And I don't, unless I, wanna have something for leftovers, I don't cook more than that. But that's not an allowance that we have at the nursing home, even though our food cooking is computerized. So in other words, we can punch in the residents, what the textures are, their diets, and the computer spits out how many pounds of this we need to make, how many pounds of that we need to make. That's the most efficient way to do it. But there's still always leftovers.
I would like to work towards a zero waste facility.
Yeah.
In this place that we're in now, but there are many restrictions, so we try to do the best we can. Just as a point, percentage wise, the electricity is consumed roughly half by lighting and half by HVAC, motors and things that run the HVAC. That's right about what the breakdown is for the electrical. Natural gas, simple calculation, we have a good rate and our usage is pretty consistent. As you can see, from 2023 usage at the 3/4 mark. We used about roughly 3/4 of what was budgeted. I feel confident going forward that we're gonna be pretty close on target to that. We have made efficiency improvements to the insulation of the building. We sealed a lot of windows, and that has gone a long way. We fixed some HVAC stuff that was broken. And we have even temperatures in there, and we've gone from several complaints a day about the temperature to almost 0 on most units, which is incredible in a 50-year-old building with
Yeah.
50-year-old equipment.
The other thing we do, when we do have a resident that offers a concern about the temperature in a room, maintenance immediately puts a thermometer in there.
I don't, yeah.
And we look, and then I have the nursing every hour take a temperature from the thermometer. There's just some people that are cold. And we don't have the ability to, go ahead, make fun of me, because I'm the other way. I'm the one that has the heat turned up.
We share
We-
doors.
We
and
share doors, so
this is
D always.
95 degrees.
It is not 95 degrees. So we have we don't have the ability to change temperatures by the room.
Right. By
Um,
floor.
by floor, we have to do it by floor, but we do hang a thermometer there because, by the way, as you'd expect, there's a Medicaid regulation that demands temperatures between such and such levels, which we don't comply with during the summer, but we do comply with it during the winter. Thank God we don't have summer surveys. They usually come in December, January, February.
Do you have more for us?
Yes, another item I'd like to point out, building and equipment repair. I'm asking for about a $25,000 increase in that. Simply the cost of everything that we buy, nuts, bolts, valves, everything has increased. So I would
If you
like
can
to
get it.
I would like to be safe there. Plus, we're obviously going to be there for a couple more years, so there's some things that I'd like to get a hold of down the road that I'd like to take care of.
You know, and it's the elephant in the room. I need to say that however the delegation votes on a different facility, it doesn't matter to me and my staff in terms of how we're gonna care for the residents. We are going to work our tails off to give them the best imaginable care. And as is seen by our last survey. You know, there's one county home that has about 30 deficiencies operating right now, including the fact they don't have a doctor. How do you like that one? In any case, you know, we're gonna do our best to care for those residents in that environment, no matter what it is. So I just wanna throw that out there. We're gonna work our tails off.
And Chairman, last point I would like to make is the percentage that I'm asking overall for an increase in the budget this year is 7.86% for my entire.
And if you deducted the increase in fuels, it would be about flat.
Right, we're paying for all the trucks that I use at all county facilities, so that line item in there for gas, oil, grease, that's for the entire county. And all salt, sand and fertilizer as well.
Doug, I have one question.
Sure.
On lawnmowers, what's the territory you have to mow and how frequently does a mower have to be replaced?
Right now, we're at, give or take 5 years, we have 5 ride-on lawnmowers. And we're getting about 5 years out of them. I haven't had a chance to, this is my first year, but I am diligent and we have one of our maintenance staff who is very, very good at logging and preventive maintenance and greasing and changing belts and making sure that our equipment is in top shape so we don't have to replace it as often.
So we have to mow everything you see.
Yeah, as far as you can see, if there's,
If it's, you know, unless obviously we don't mow the hayfield, but everything we don't mow the football field. But everything that you see, we have to mow. The Master Gardener Program through Cooperative Extension does all our gardening. And the gardening at Hyder, which if you've ever seen it during the summer is stunning, is done all by volunteers.
Nice.
Yeah, it's a husband and wife that do it all. Just out of the goodness of their heart.
It's an honor to support them.
For years they've done it. But they do it and it's totally free to us. They even, yeah, beautiful, beautiful in the courtyard and as well as as you drive up to it. But because Hyder's shaped in the U shaped in the courtyard, you'll see that also.
I've seen it, it is beautiful. Well, any other comments or questions or anything? Okay, let's move on to library, please.
Again, the primary increase in laundry is purchase of linens. We have to keep a par value. Because, you know, once the linens go to the jail to be washed, you know, they're washed at the jail. Linens are washed at the jail, where we use, you know, labor at the jail. But to bring up the par value or to keep the par value at its appropriate level, the cost of linens have just gone through the roof. So we're actually cutting back a little bit on the par value. But my director of housekeeping and laundry feels that we'll have an adequate par level. And the nice part about doing the laundry in-house is that if for some reason we have norovirus, which we haven't had lately, but we have had a few years ago, which requires frequent linen changes, we can ask them to work some overtime and more frequently wash our linen, you know, because it's right here.
So linens are washed at the jail and then, personal laundry of the residents is washed at the nursing home.
That's correct, because they're washed at two totally different temperatures.
Yeah.
If you ever get a sweater that goes over to the jail for laundry, somehow gets missed, it fits a doll when it comes out. Cause it gets so shrunk, cause we have to, by Medicaid regulation, we have to wash linen at a certain temperature. And they come and stick those temperatures, just like the dishwasher, we have to record, every day, we have to record 3 dishwasher temperatures. If you don't, it's a deficiency.
When you have something like norovirus or something that can just going around, how do you keep the inmates at the jail from getting sick during the long?
They gown up. You know, they gown up, so it's just the inmates that load the machines. That, you know, you're worried about getting anything from the linen, so they totally gown up, you know, I'm talking just as if we would be caring for somebody with COVID. You know, they'd have gowns and masks and eyeglass coverings and hair nets and the whole bit. So we want to make sure they're safe too.
And how is the safety record with those people? You are adequately protecting them.
I've never had anybody that's gotten any illness as a result of working in the laundry. And you know, we've had the laundry for 20 years at the jail. Because
Used to be different.
we built the walls around after we got the machine in. So if we need to replace the machine, we need to take out a piece of 2 rows of block.
Oh, my God.
Because the machines are so big. But so we actually built around the machines. But it's by far the most economical way to do it. I mean, that's not block that goes to the outside. You know, it's inside block, but we need to take out about 2 rows to get the dry, it's not the washers, it's the dryers. The lint catcher on the dryer is as big as a baby's bassinet. That's to give you the idea of the size of the dryers.
Well, position of pharmacy.
Now, and this is really as a result of our increase at Hyder. The operation of Hyder requires special doctoring. It's not, and you won't get an MD to work at Hyder. You need a board certified palliative care physician, which we have 2 and we pay them $150 an hour. That's just the way it goes. And that also covers the doctor costs at Riverside. One of the questions that came up by Mike Lerman was, where do we bring in the revenue from the Riverside doctor? And that's as part of on the revenue page, which went over this morning, is Medicare B revenue. So the doctors see the resident do a dictation or hand enter into our computer their notes. We have 3 of our practitioners hand entered their notes. The other 3 practitioners, 2 of which are psychiatrists, still dictate their notes and we transcribe them. But no note, no payment. So that way we ensure that doctors always do notes. Because there's, I've covered at other facilities where, I don't know what you did in Carroll, did they handwrite their notes? Or did they dictate their notes?
They all did, handwritten right into the system.
Yeah, okay, cause when you handwrite your notes, do you ever hear complaints about doctors writing?
No, I never heard that.
So they either type in their notes or they dictate their notes and we transcribe them. And then we must have 200 pages a week in dictated notes. So the 3 of us split the notes. I do one doctor, all the notes from the hospice house, read them. Jen does Dr. Malari, and the other Jen does
Nurse practitioner.
the nurse practitioner's notes. So we read them all and I'm certainly not qualified to say if the notes but I know what they need to include. And if a note doesn't include the proper things, then we'll reject the note and they'll have to redo them. I like to read Hyder's notes because I like to read Hyder's notes. And I probably have the more notes because I have Dr. Chalet who does all the renewals, but it helps me. Because he does just about all the renewals in the facility. That's how I learn, that's how I keep in touch with the medical aspect of our operation. And I call every night at 11 o'clock.
Every night.
Every night, every single night. For 36 years, I call every night at 11 o'clock. Sometimes it's, if I'm at a late football game, sometimes it's midnight, but I always call. I've never missed the night. And Jen used to be our 3 to 11 super. So she would get the 11 o'clock call before she left, but that hasn't changed. I learned you're either in or out of this business. You can't be halfway in.
And that's in addition to your 50 hours a week.
Yeah. But it doesn't take long. It's probably 20 minutes every night.
Yeah, we're talking about that, so the doctors are not staff. So
No, they're not.
They're not in the budget,
They're paid as a provider.
right, so, okay.
Yeah, they're paid as a provider. In other words, we don't, Primex will not cover their insurance. So they need to get their own insurance. And so they're not staff.
Right.
Although the nurse practitioner, they will cover, and the nurse practitioner staff. So, but our doctors, no, Primex won't cover them. Our insurance I've kind of asked that they reconsider. And they might in a separate policy, but right now we're not there. Cause I'm thinking if I can there's so few claims, I've been there 36 years, I've had 1 claim. And actually, we won. That claim that was dismissed in federal court. I think, so, and I think we have still 1 pending claim, but, they need to carry, obviously, insurance to protect themselves. So we don't accept responsibility if they're sued. That's part of our contract with them.
You're not gonna do much better than $150 an hour anyway,
I wouldn't think so. We
and carry their own insurance.
and carry their own insurance and their own licensing fees and
Yeah,
their own continuing education and all those other things.
Okay, the executive committee's been talking a lot about the infection prevention, and I think we've got the whole delegation about that.
Sure, just, we're under a lot of requirements by, our requirements on infection prevention comes directly from Medicare. No options, no nothing. When survey is here, survey focuses, there's 5, 6 surveyors here for 3 days, plus a life safety surveyor. And one day, one surveyor does nothing but infection control. And also we're graded on that. On our, if you look at CMS compares, I talked about a 4-star facility, hoping to go, you'll see that that's part of our grading. Is a level of inoculations of prevention, things that's part of our grade. And we, I mean, there's a number of things in that category, but one of them, one of the things is certainly, and a big piece of infection control.
Any questions?
Oh, this is the other $5,000 that I added. Remember when I told you there was 2 $5,000 people? This is the other $5,000 I added because Chris Hamilton, who's our infection control certified infection control, because you have to be certified, by the way. You have to go to a program and pass an exam. So a facility our size has to have at least one certified infection control person. And we're actually working on getting a backup certified. But right now we only have him. And so he took over all of the COVID responsibilities that Brianna had. Which right now doesn't seem like a lot, but we still have to report, even if we don't have any COVID. So we're still obligated to report to CMS and to the state.
It's remarkable in a facility like that to have so few illnesses going around.
Well, I mean, we have our share of. The only thing we can do is help with preventative illnesses. I can't fix somebody that comes to us, with a serious illness, particularly at Hyder. We can't fix that. But what we can do is stop them from getting what CMS considers preventable illnesses. Like 3 years without flu. Man, I know I hate to say that. It's like knock on wood, and I don't know, I can't give you a logical explanation as to why we haven't had it. I wish I could, because if I could, I'd make $1 bazillion, because I'd spread it all over everywhere and nobody'd ever have any flu. But,
Well, they said COVID knocked down the spread of flu and when it was really rampant.
what some people say is that people might have had flu, but it was perceived as COVID. But that's not accurate, because all of our COVID comes as a result of COVID testing.
Yeah.
We test, oh Lord.
A lot.
A tremendous number of people, on a weekly basis. If you have any symptoms, if you have a fever, if you have any symptoms, you're tested. Because we can't afford an outbreak.
Isn't it like when there was a problem with flu, and if one person got it, others would be injected, so.
Well, it's not injected, it's called Tamiflu.
No.
So we would give them, it's a pill, and it's harmless. In the sense that you can give it prophylactically. So we give it to the person who has flu, we give it to their roommate, and we give it to their bathroom mates. So those are the 4 people that are are mostly exposed. It's relatively inexpensive, and we purchased it ourselves, and it has a long shelf life. So we always make sure we're geared up in case we have a flu outbreak, that we can start it immediately upon testing.
I keep seeing hit points, and what is that on the wall?
No, just a wood sign, that's what I'm knocking on when GD says things like we haven't had flu.
Oh, we're knocking on wood.
I thought it was residential. Okay. Whose phone is going on?
I don't know.
I don't know how to shut it off.
I just can't stay quiet about it because I just
We-
can't. I'm on a COVID efficacy response task force. I've literally been on the COVID thing for like 4 years. So I just want to speak to, you can't just say because they tested and it tested for COVID. So the PCR test does not test for COVID. It doesn't, it spins a cycle. A positive test could be for flu, could be for somebody that had COVID, could be for the common cold. Coronaviruses are in a multiple of different things, so we can't say that. when,
By the way, I agree with you.
and I will give you all this data to back it up, because I just don't want that. That's misinformation. So they literally, when they were starting to track COVID, they stopped tracking flu. The CDC says it right on their site. So I just
No, I-
wanted to be clear about
I
that,
don't
okay?
disagree with you at
All right.
all. I only go
Cool.
by the regulation that I'm required to go by.
All right,
And I probably agree with you more than I agree with the regulation.
okay. I
But
just
we're
want,
stuck with the rules.
yeah, I know, I get it. I just wanted to.
Yeah, we're stuck with the rules, but I don't disagree with what
All
you're
right.
saying.
Thank
We
you.
have certain criteria that we have to follow for the state.
I get it, I know. Okay, on that note, bye. I'm up.
Seeing how some of the rehab is
Um,
going, can you talk with us about?
Oh, sure. That's our therapy. Mike Morse is our therapist. We have two physical therapy assistants. And, you can see we have one less physical therapy aide, so the total budget has gone down. Mike's been our therapist for quite some time, so any of our residents who, can benefit from physical therapy. Whether we get directly paid for that or not, that resident gets physical therapy, because they might have the opportunity to go home. Some of our residents come to us with multiple medical problems, and one of their problems is they can't walk upstairs anymore, and their home's a 2-level. When I had my home built in Somersworth, I don't know, 3 or 4 years ago, it's a 1-level home. You know, because I want to age in place, and I don't want to have to walk upstairs. So, you know, I'm pretty old, so, I don't, no, not as old as. I'm the second oldest person. My situation is that, if we can help them, get back upstairs or move around, they could go back home. If we solved all their other issues. I mean, walking upstairs isn't not being able to walk upstairs isn't a reason to be admitted to a nursing home.
Right.
It's many more medical issues than that. But if we can stabilize those other medical issues, and the only thing that prohibits them from going home is they can't navigate inside their own home. The fact that we have physical therapy, occupational therapy, is a real enhancement to that. And there is some physical therapy and occupational therapy that we get reimbursed for from Medicare. And it is also something we get reimbursed for in our actual Medicaid reimbursement. It's part of that $220 a day that we get from Medicaid. So we get reimbursed for those
And I
services.
think it's important to mention that the other person is private pay on Medicare and Medicaid. They all get the same quality and level of treatment, so there's no distinction.
I can't even tell you who's private pay. I have no idea. I mean, I trust my staff who does, do you guys know? I trust my staff in the billing department to do the right thing. And I don't have any idea who's private pay or who isn't, because it doesn't matter. It just doesn't matter. Everybody's treated the same.
We take everybody.
Yeah, and we take, being 92%, you know, I have 8 private pay people right now out of 170 residents, so. And this budget's based on 180 residents, so we're admitting as many as 3 a week right now. In fact, we would have admitted 3 additional ones if the other nursing home that will remain unnamed, it wasn't infected with RSV. And they are really infected with RSV. We've only had 1 RSV, and we shipped her, she went to Hyder, where she could have an individual room. And we treated it that way. We have that luxury that if somebody has a highly infectious disease like RSV, we can use Hyder. You know, during their 5 or 7 day period that they need to be isolated.
Okay, any other questions on that portion? Activities,
Activities, because our census is going up, I restored 1 activities position. Activities used to have 3 more positions, but when we lost, you know, when our resident population went down because we couldn't get the staff, but now we're staffed. So, I allowed her to add back in one more position, of the ones that we cut. Also, we have a dedicated, as part of that extra reimbursement, the extra staff or the new staff has been pretty much dedicated to their behavior unit. So we have 2 occupational therapists. You see the budget's gone down slightly. Part of our occupational therapists is charged to the behavior unit. Part of it is in this budget, you can see, it looks strange that the head occupational therapist actually makes less than the person that works for her, but a portion of her salary is in the behavior unit. Because I can get reimbursed for it. So if I can get reimbursed for it, I'll take it. I'll move, we'll split her salary. It doesn't matter to her. She doesn't see it and she gets a paycheck. So, you can see that budget's gone down slightly. But this is also where I was telling you about the enhanced swallowing and she also works with the dietitian to determine the texture of the diet. A lot of that is done in cooperation between occupational therapy and our dietitian, all of which are federal requirements anyway. So we wouldn't have the choice. It's a nice combination that they can work together, because there's a new way of classifying diets so that everybody classifies diets in the same way. So in the past, when you used to go to the hospital, they would say a soft diet. Well, a soft diet might mean something different to us than it means to the hospital. Now there's a uniform system of, that's what it's called. It means, I don't know what the acronym stands for.
Whatever it is, it's uniform.
Whatever it is, whatever it is, it's the acronym they use.
It's nationwide.
It's a nationwide acronym, so that if somebody, and this isn't unusual with the recent relationship between Wentworth Douglas and Mass General, it's not unusual that some of our residents who might go to the hospital might end up in Mass General. So now we're using the same language as Mass General, which uses the same as Wentworth Douglas. And not many people go to Frisbee, but those that do could easily end up in Portsmouth. Because as you know, they're together now.
Social service department.
OACA.
A lot of detail work there. Okay, now start that, right?
Oh, the decrease? I have one less social worker.
No, I wasn't talking about that. What's the kind of work that they have to do?
Oh, social service, about everything. I depend on them, I depend on the social workers. When I meet with families, when they come in, and I'm not telling you I meet with every family, that's not true. I do work every holiday. So that I can see families that I might not otherwise see because they have a similar work schedule to me. So I work Christmas, New Year's, I work President's Day because they're off and they come in during those times to visit their loved ones. And my office is just right as you walk in. So, I think myself and what we do is send out an email to ask what department head's working the holidays. So I'll know who I can call for help if I need it. If it's a nursing question, one of the Jens usually work the holidays, so I can, ask them to help me, or we always have a nursing supervisor too, of course. But it's always nice to have that backup, because obviously if there's medical questions, I can't answer them. In a lot of cases, I can't answer, and they can. However, because we have a portion of the unit closed, I need one less social worker. We need one less social worker. When he left, we cut it out of the budget. So he's in Brazil right now as we speak. His wife is from Brazil, so they live there. And he was a wonderful social worker.
So, how do I look at this, Ray? You're looking for how much this year?
I can't hear you.
Oh, I'm looking for the numbers here. I know I gotta,
Right here,
I'm gonna have to leave pretty soon.
right here. We're almost done, actually, but if you're looking for a number, that's the number,
That's true. Okay, what was your number last year, if I may?
right next to it.
Oh, it is.
Yeah. However, again, there's about a $5+ million increase in revenue.
Right.
So this is about a $3.6 million increase in expenses, but a $5 million increase in
And
revenue.
the revenue estimate is,
Here, I'll give you mine.
or is it on this one? No.
No, here. I'll make it real easy. There we go.
Gee, I'm glad you saved the place for me, right beside you.
Yes. There's our revenue estimate that was approved by the revenue committee earlier today.
Well, this one has.
Wait, right on this line?
This line here,
You want me to grab that one?
this is how much it increased.
Oh, that's the increase.
That's the increase right there,
What is the total?
right here,
Right there, okay,
okay?
He's
excellent,
just looking at the.
excellent, thank you.
Yeah.
Okay, so we've concluded learning about all the departments, all the activities.
Yeah, the insurances were reviewed by the revenue committee.
Yeah.
And the revenues obviously were reviewed by the revenue committee
So
earlier today.
this is positive?
Yeah, it's a $2 million increase above the expenses.
So what is the taxpayer amount gonna be?
I'm sorry, you're gonna be there, get that away from you.
So.
40,320, is that right?
Dan?
Yes, so the total expenditure for Riverside is 33,893. So it's about $3 million to the taxpayer.
Oh,
So it's
okay.
$2 million.
I was looking at the other one.
It's
okay.
$2 million less than last year.
Well, that's pretty good.
We
That's
do
all-
we do the best we
That's
can.
all I need to know now.
We do the best we can.
Yeah, I know you do.
You mean 2 million more?
No, 2 million less than
Less
last
than
year.
Looks like you're reducing with the revenue.
That's right, because the revenue went up more than the expenses. And we don't need, well, a substantial decrease in nursing pools and travel nurses. Which to me is critical for the best operation of the facility. When I covered at Rockingham, the problems that we had when I was there at Rockingham, all were a result of travel nurses. And there was a couple of relatively serious issues. I think Dee can give you the same idea from Carol. If we had any issues, it was a result of pool nurses.
Yeah, we definitely think that the investment and the continuity of care is much less when we have an agency that comes in once a month or maybe just once. Than having our own employees who know the system, know the residents and everything. So it definitely has a major impact with pool staff. You know, if we want to pay, we'd rather pay our own people to have them stay with us.
And it's still cheaper.
Right.
That's the part that's the weird part, eh? So I get these questions like from Rockingham, how come you're fully staffed and I'm paying $9 million to nursing pools? And I say, pay your people. You're paying the nursing pools more, pay your people the right amount, and you can get the staff. And fortunately, the commissioners allowed me to undertake that three years with the ARPA funds, and now we can fund it ourselves. So, you know, we managed to be able to do that and we're staffed.
If I may, we also have recruited and coached all of the
Totally.
agency staff.
They like the agency staff that we might have used last year. We poached them. They would rather work for us than to be bounced around to other facilities.
Oh,
So honestly speaking too, we poached quite a few from Wentworth Douglas.
Yes, we have.
We poached quite a few nurses aides from Wentworth Douglas.
Well, not to mention our aid classes that we've had great success.
Yeah, we run our own nurse aid training programs and we've managed to retain our own people that we train. We also get to look at them, you know, while they're going through the training. So we're not obligated to hire them. But when they go through the training, we can, if somebody doesn't appear to cut the mustard, so to speak, we don't have to hire them. So we get a chance to try them out. It's the same thing we do at the jail now. If we're gonna hire somebody, we ask them to volunteer to come in and work a day with an experienced correctional officer to see if they're cut out to doing it, rather than having them come in, put them to work, and then have them quit after 2 or 3 months because, you know, it wasn't what they thought it was gonna be.
Yeah.
So we've adopted that principle at the jail also, we only ask them to do a day. With the nurse aide, we get 100 hours, 120 hours, 120 hours of observation. You know, as that's what they're required to get their license.
Yeah.
So it's worth it to us to run those programs, and it doesn't cost us anything. So.
Again, I want to thank the staff for all being here today. Very helpful, I appreciate that. Ray, thank you. Thank you. And we have a motion, please, on the recommendation.
I have a question.
Okay, go ahead.
Thank you very much. I just had a question.
Sure.
It's a little confusing because we have expenditures on the nursing home through September.
You actually have them through the end of the year. Yeah, that's correct.
So will you be updating this or?
That is the one you got.
This one is the updated.
That's the updated one.
Okay.
Until such time as the audit's done, then you're likely to get another one that will, because that's why it should be stamped draft. I don't know, but when the audit's done, you'll get a whole nother one. But I will tell you that the audit's not gonna be done till June.
I learned that and I appreciate that, but I was wondering, based off of that information, did we ever get the final totals after that last year's?
Oh, you did, yep. And in fact, Diane has the audit right here. We offered the audit to everybody, every member of the delegation, everybody. And we don't send it out because it looks like this.
It's also on our website.
And it's also on the website. It's
But
expensive.
I'm just looking at the final total,
She's,
that's all.
I think what she is referring to is the fourth quarter report that we sent out, looking for an updated one come June.
Okay, well, I'm happy to do that.
Yeah,
You're right, I did not do that last year.
could we get that?
Sure.
Just to kind of complete the.
I'll
Yeah,
make a note.
I would
yeah, we'll make a note. Happy to do that.
And one more question, if
Sure.
you don't mind, so 215 beds, what's the average for the year that's been filled?
The average for the budget projection for this year is about 183.
183.
Now, I'm hoping I can exceed that. You know, I want to be reasonable. We have the staff to do 183, so I'm admitting right now, we're at about 170. I'm admitting 3 people a week. So it won't be long before we get to the 183. And then I'm considering, and I don't want to give the 2 gens here a heart attack. But I'm considering reopening one wing of unit 3. And if we do, that would give us another 20 beds.
So can I have one more question? Since you shared that, do you have that within the budget?
What I would do is come to the executive committee and I would say to them, listen, executive committee, I can raise this amount in revenue if you increase this amount in expenses, but don't affect the tax rate. Okay, so if it looks like I can exceed the revenue projections and it costs me extra staff in order to do that, I would have to go to the executive committee and say, look at executive committee, I need X amount for aides and a nurse as an example. I'm just making that up. But with that, I can generate this amount of revenue. And then the executive committee, it can't exceed the amount to be raised by taxes. It can only make it better. Because any change in the amount to be raised by taxes has to be the whole delegation. So I would never open up additional beds if it was going to cost money. I would pursue that in next year's budget. But if I can open up more beds on that one wing of unit 3, then I would do that through the executive committee. But I can't do that independently. It has to be with a vote of the executive committee of the delegation.
But you have a ratio requirement, so you can't open beds if you don't have staff. Right?
That's correct. But I feel pretty good about our staff.
No,
I
get
but
it.
you know, if I can generate additional revenue,
Right.
then I'm gonna do it. I'm gonna do it. And there'd be there's no way I'd be happier than to come to the executive committee and say, I can make $100,000 by opening that wing. And it's nothing that would make me happier.
Kelly has a question.
Could we go back to page 33, 02.5180, the physician and pharmacy
Sure.
section? I just wanted to understand
The note's wrong on there.
the 550 to 650.
Right. Well, no, the amount's correct. But it says in the note that
Yeah, it's saying that
used
you're
to
gonna
be-
reduce
it-
cost.
It used
Okay.
to be higher in a previous year. So I didn't catch I should have fixed the note before I sent it out.
But
it-
why are we paying for that amount of money for physician services when Medicaid is covering people's doctors directly? I don't understand that.
Medicaid, you won't find a doctor that will take care of a Medicaid person for what Medicaid reimburses. You won't find a dentist that will take somebody, we could,
Especially
the state of New Hampshire, you all created a Medicaid dental program last year.
Correct.
So let me tell you, or I'm not gonna tell you.
But
Let Jen tell you what we have to do to find a Medicaid approved dentist.
But
Where did we go?
We went to Nashville.
To Nashua.
Medicaid.
Somebody that will take Medicaid.
Yeah.
And for their dentistry, we have to go to Nashua to find that person.
But I'm not talking about the care though. I'm talking about, this is for a director person. This sounds like we're paying for the care delivery.
We are. Medicaid doesn't pay the freight. It doesn't pay the freight for anything, doesn't pay the freight for our care for the residents. That's why Riverside loses money. It doesn't pay, and when you're 90+% Medicaid, that's why we need a county subsidy in order to operate. That's why we take people from private nursing homes, because they can't afford to care for them at their Medicaid rate. I have 3 people waiting to come from, I won't tell you it's Dover Rehab, that has RSV right now that I can't take because they want me to take because they're losing money caring for them in order for them to stay in business.
Yeah.
I need to take those people from them, and I understand that's the county's job. Okay, that's why the county runs a nursing home, is to help take private nursing homes and keep them in business.
Okay.
Because they can't afford to have 92 or 3% Medicaid, because they don't get the subsidy from the county that we do. I mean,
We're looking for a nursing home for my mom. It's almost the first question they ask. This is private pay.
Yeah.
You understand that, right? Yeah.
yeah, and if you ever found out the rate, I'm sure it would be between $350 and $400 a day. That's the rate for a private pay nursing home. And I'm not saying that's unreasonable. Please don't misunderstand. I'm saying that's the going rate.
Yeah.
And that's just the way it is. Part of that, though, in fairness to the private nursing home, is the fact that it helps subsidize the Medicaid rate. You remember that the money that you all appropriate at the House, okay, and the Senate and the state government, only pays 70% of the allowable Medicaid rate.
Mhm.
The other 30% of that Medicaid rate is taken off of our reimbursement rate by what's called budget neutrality factor. So we submit our cost report, for what it cost us to operate our facility, like every nursing home does. And they determine what is allowable under Medicaid rules. They see how much it would cost times the number of people that are on Medicaid. They see how much is in the budget and then cut the rest and just say, sorry, you don't get reimbursed for that. And right now that's 30%.
I went to the.
It's called the budget neutrality factor.
I went to the Delta Dental event a couple of days ago in Concord, and they explained that there are only a handful of dentists in New Hampshire who will take Medicaid patients.
Well, and I suspect those are dentists that either are well off and they have a very strong financial base, of people, or they're new dentists that are looking, would rather take the Medicaid rate than no business at all. It's one of those two, but like I said, we tried to use the system, and the system even said that they would provide transportation. And they didn't provide any, we had to drive to Nashville. You know, to have the dental work done. Now, we have a dentist that comes into the facility, but I mean, all he does, you know, minor extractions and other, if you need major dental work, this is what the program that you all voted for last year is supposed to do. I'm telling you right now, it's an abject failure.
They don't pay enough.
They don't pay enough, and I'm happy to testify to that in front of the legislature. They don't pay enough to attract dentists. If we have to go to Nashville, I mean, you know, that's an hour and a half from here. That's ridiculous.
Ridiculous.
And we call, how many dentists did you call?
All over the place.
13.
We called every dentist imaginable for this, and you know, because we were all excited. I mean, we thought this was gonna be really cool. You know, we could get our people's dental work done locally. And Nashville was the closest, and we had to transport. And there was no transportation, as much as we were assured that transportation was gonna be included.
Yeah, well, one of the
That's becoming a
traffic
problem
things
too, the transportation. Yeah.
Transportation's ridiculous now. Nobody transports. We can get our residents transported to the hospital. We contract with stewards to do that. In an emergency, Dover fire will come out. But to transport some of our residents to appointments, stewards used to do that with us. Now stewards won't do it anymore. So if we have I'm just gonna say it, if we have a 500-pound resident that needs to go to the doctor, we just had that this week, that's how I say it. If we had a 500-pound resident that needs to go to the doctor, we have to kind of squeeze them into a wheelchair that
Maybe a little small.
will be small, because we can't fit their wheelchair into even our bariatric van. The wheelchair doesn't fit because it's just too big. Now, this is a new problem for us, because in the past, they used to transport it for us, but they don't do it anymore.
And if they do, you're on the phone with them for an hour and a half or so to try to make arrangements, and then they don't show up.
And that's the other problem, is they don't show up. Fortunately, one thing we're really blessed with is the fact that our dialysis center, because we have now 4 people on dialysis, is just around the corner.
That's nice.
So the fact that we transport them to dialysis, I don't have a problem with that, because it's just around the corner. And we're lucky that, I think we still have one gentleman that goes to Portsmouth?
That's right, yeah.
Yeah, we have one gentleman that we admitted from another nursing home. And he still gets his dialysis in Portsmouth, because they don't have a spot for him at the local dialysis, but they'll put him at the top of the list. And right now, the family is compensating a transportation company to bring him to Portsmouth.
Which is, you know, it can be unsafe too, because he's alone when he's transported, so.
Yeah, I mean, in other words, they leave him.
What's the percent of what Medicaid pays to what the normal rate would be?
Half at best.
I heard it was 48%.
Yeah, well, that's
All right.
as close to half as you can get.
I have
Yeah,
one
okay.
last
I
question and then.
Check and see it.
Yeah, you get the right information.
All right.
And one of the things I wanted to say is that most of us are relatively young and relatively good health. Except for Sonia. And, but dental health is so critical. If you are missing teeth, you can't chew properly. If you can't chew properly, you can't swallow properly. If you have poor dental health, you get infections and diseases. And so it's critical that we have this dental care, and that Medicaid supposedly is supposed to cover for things. I guess we all need to be aware of that in Concord when it comes to passing these programs, to make sure we not only pass them, but to make sure they're effective.
And don't get me wrong, I was thrilled. I was so happy that you guys did that. I thought that was one of the best things you ever did. It just doesn't work.
What else is new? That's the federal government.
Yeah, it just doesn't work.
No.
Well,
And I'm sorry.
if you don't put enough money into it, it doesn't work.
Yeah, I'm just sorry. I'm sorry it doesn't work.
Do you
Which
have
the-
it listed anywhere in the budget? Cause I wasn't able to find it cause you know, in all budgets usually have it incorporated in there about with bad debt, like how it carried.
That's another thing that you're gonna get from, in that answer to Mike Lerman.
Yeah, I asked another representative about that just because I didn't know, I didn't see it in there and okay,
Okay, but you'll see that that's something that we pick up in the audit.
okay,
There's another thing we pick up in the audit that you won't see in this budget. Every 6 years, there's 53 pay weeks. If you pay weekly, every 7 years, it's 7 years. Every 7 years, there's a 53rd pay week. You won't see that in here either, because every year in the audit, they set aside a 1 day's pay. So that in year 7, you know, you don't have to add it to the budget. Now, if you
but
pay,
bad debt though,
I'll tell you,
how is it incorporated in there though? Because that's,
We set an allowance against our accounts receivable, so we have an allowance for uncollected.
okay,
And I can show you where it is in our financials.
but it's, so it's not.
it's not budgeted for.
Not high enough that it would
We
make.
don't budget for it. There's an allowance that has been.
I can tell you, my billing
against
people
accounts
told me that this
receivable.
year it's between $103,000 and $110,000 in uncollectibles. And I'll tell you
Okay,
exactly who
alright.
those people are. Those are people that come here and the family, not usually them, the family's cheated somehow in their Medicaid application.
Okay,
And we're penalized, the facility's penalized for that, usually a period of time. So they gave money away or family took money from them. Yeah, and they say, oh, no, we didn't, you know, and then when because the state goes back 5 years. They go back 5 years to see if there was any inappropriate distribution of funds.
and if there was, they come back to you.
That's correct. They come back against us. And when we
What
cannot,
about all the depreciation and all that stuff? Is that,
Well, see.
so that to me,
Those are all, they're separate funds. So we have a general fixed asset fund, which shows all of our. What is that? We have a general fixed asset fund and we have depreciation, which is actually, that's going to be my job on Monday, is calculating depreciation
Okay.
on our assets. So it's governmental fund accounting, so all of these items are found in different funds. So we have a long-term debt fund, we have a general fixed asset fund, and that's where that is all calculated.
that's,
But depreciation is not something that we fund, we're not required to fund. It's just done a little differently in governmental accounting, and it's
Okay.
accounted for.
okay,
If at any time you would like to see where it all works out in the financials, I'd be happy to go over that with anybody.
so,
Just wanted to understand.
which is another reason why, when we talk about fund balance, okay? Fund balance doesn't equate to cash. Fund balance equates to cash and money owed to us that might not have been paid. Let me give you an example of $2 million right now. The $1.4 million that we hope to receive from the opioid, well, not hope to receive, that we will receive from the opioid trust fund that I've talked about in front of the delegation, in front of the executive committee. We don't have that cash. We've been through, the governor and council approved it. The state then audited us. We just finished that audit last week. And it'll take 3 months we're estimating 3 months before we get the money. So now that will count as part of our surplus for this year. Okay, but we don't have the cash.
Would that be for 24 or back to 23?
No, that's for 23.
It would be accrued, right?
It'd be what we call accrued revenue.
Okay.
And I'll give you two more, I'll give you another example of about $300,000. That's 1.4 million. I'll give you another example of 300,000. When the government funded ARPA through COVID, it also lessened the Medicaid rate that the state contributes, or in case of long-term care and home care, the county contributes, our $11+ million. They decreased the rate about 6.4%. At first, the first year, the state kept all the money. And wouldn't give the county its share, still made us pay 50%. We had to go to the legislature. You guys passed a law that forced DHHS to pay us our share. So when we began getting that share, but we were told that it was gonna end when the president declared the COVID emergency over in March. Okay, remember he came out and said the COVID emergency is gone. Well, that's not what happened. The federal government passed a law that says they were gonna phase out that 6.3 or 6.4%. So in the second quarter, I'm talking second quarter of our calendar year, it went to 5%. In the third quarter, it went to 2.5%. In the fourth quarter, it went to 1%, and now there's no more, it's gone. But the state still hasn't paid us for the third or fourth quarter yet, which I had to hunt for Henry Lippman. By the way, he's a wonderful state employee. He's great. He's the head of Medicaid. But I called Diane and I said to her, how much, because I thought we'd have to accrue the fourth quarter. I said, how much did we get in the third quarter? And she said, we haven't gotten the third quarter yet. So I got right on the email to Henry Lippman, said, where's our third quarter money? And he goes, we'll calculate it. So I said, well, while you're at it, calculate the fourth quarter too, because you owe us that. And it's a simple mathematical formula. I mean, it's not complicated. Finally, 2 weeks ago, he sent me an email that says, I worked Saturday, calculated it out, you'll be getting your money. And that's $310,000. But we don't have that cash.
Right.
But we'll accrue it like we're gonna get it. We just don't have the cash. So between those two things, that's $1.7 million as an example. Plus, everybody that goes on Medicaid, it's at least 6 months before we get paid. Because the family has to qualify for Medicaid. Now we'll get back paid. It just takes 6 months to get the payment. So when we tell you we have $2.4 million in fund balance, we ended the year with $555,000 in cash. Yes, we still have that fund balance, but we haven't gotten the revenue. It's because we're subject to the federal government paying us for the boarding of the inmates at the jail. We haunted the Bureau of Prisons for 6 months to pay us.
And they're still in arrears.
The US Marshal and ICE are pretty good. They're about 45 days. My direction to the billing person at the jail is you have to have a bill to them within 5 days of the close of the month. I don't care if it means you have to work the weekend. I don't care. I want a bill to them within 5 days. And it takes them about 45 days to pay us. So we're constantly paying correctional officers, paying staff for things, and constantly getting the money well in arrears. So when you see one of those emails that I sent to Representative Newton, because that's one of the things you're gonna get, I gave him the amount of money that we had on hand at year end. And it was $555,000. And somebody's gonna say, well, wait a minute, you said you had $2.4 million in fund balance. How can you only have $555,000 in the bank? It's because it's accounts receivable that we don't, I wish we were Rochester, where we had $32 million in a fund balance account. Man, I'd do anything. I tease Mayor Callahan on a regular basis about, let me have some of yours. I mean, you got $32 million. Give me a piece of yours. And he of course laughs and walks away. But it's not it's a little different because we're so far in arrears with our payment partners. I just wanted to say.
Getting back to our budget.
Sorry.
Maybe I'll ask you after.
Oh,
Sure. I mean, it is interesting. I'm sorry, but so when it goes into the unassigned fund balance and it's for last year, moving forward, does the DRA pull from that to reduce anything,
No.
any of your,
No.
it just sits there?
Yeah, the unassigned fund balance, like I said, we want to, the DRA recommends you have between 5% and 13% of unassigned fund
Yeah.
balance. And the reason they have that is it substantially affects our ability to borrow.
Mhm.
Because if the lenders want to be sure that we will have, in the case of a bad revenue year, that we don't meet revenue projections. They want to be sure that we're gonna be able to pay them back.
It's one of the indicators of the financial health of an agency is the amount of your unassigned, too much. I mean,
Too much
there's
is,
an argument for too much.
too much
Yeah.
is ridiculous
That's
because it's
taxpayers' money.
taxpayers' money.
Rochester.
But
Does
not
that tend
enough,
to happen at the county
Oh,
level?
we've never had that.
it's never been one of our problems.
No, we've never, this 5% is the highest we've ever had.
Okay.
And again, it's, I wish I could tell you that. The other problem, of course, if you use unassigned fund balance to offset operating expenses, you're starting the next year that much in the hole.
That's right, that's right.
Because you have to make up that
That's
money
right.
in the next year.
Yep.
Yeah.
You know, if you don't have any more unassigned fund balance to put in there, you're starting that much in the hole. I mean, if you're one of the counties, like, give you an example, Rockingham County, much larger than we are. They wanted to change to a fiscal year, which means that they had to, in order to do that, they had to create an 18-month budget.
Right.
They had so much fund balance that they could fund that 6 months
Without raising.
without raising taxes.
Hmm.
So they probably raised, I don't know, 80, 90, well, they probably raised at least 50 million in taxes. And that means they had a $25 million fund balance. In order to Rockingham. In order to fund that first 6 months and not raise taxes. That's how much fund balance you would need to have put aside. So when
Spikes at the next tax.
well, it won't actually, because it's a one-time, it's a one-time increase, but I wouldn't want my county taxes to go up 50%.
Right.
You know, I pay $11,000 a year in Somersworth in property taxes, just got my bill. $11,000, well, yeah, and I pay about $900 in county taxes, but I wouldn't want that $900 to be $1,350. You know,
I'm looking for.
Thank you.
You may want to move up north.
We gotta get going here.
Well, further conversations continue. After.
That's right.
We can do a motion to accept the commissioner's recommendation for the budget. May I have a, okay, motion's been made and seconded. Have you got that?
I'll second it.
Okay, is there any further discussion on this budget? There being none, all those in favor?
Aye.
Aye. Any opposition? Apparently not. I thank everyone for participating today. All of you for being here today. And thank you, Ray, thank you, everybody, thank you. And Kelly, we would sing happy birthday, well, they can, but I can't.
No, don't do that.
it's my wife's twin sister's the birthday today. Too. The twins are
Not her twin.
not her twin, but she has twin sisters.
Yeah, that would be the same birthday. Have a little bag. I know, well, I need to.
Yeah.
We don't do it anymore.
Will it kill it?
We monitor them and put them to work. Give it to the state. Yeah.